Hey there! Today we're talking about 4 things to know about your cycle if you're trying to conceive naturally. Now, this is one of our Making It on Monday sessions, and Making It on Mondays is brought to you by the Acupuncture Pregnancy Clinic, which is an integrative traditional Chinese medicine clinic and an acupuncture clinic dedicated to reproductive health, to IVF support, and to pregnancy care. Now, these weekly sessions are designed to help and support those on their fertility journey and are all about empowering women and men who are trying to conceive through providing weekly workshops with relevant and research-based resources. Now, in these weekly sessions, we cover topics such as TCM fertility, nutrition, and mindset, as well as tips from the experts both inside and outside of our clinic. And we also share relevant resources and research. Now, today I am your host, and for those of you who don't know me, my name is Louise Jeffrey. I'm a traditional Chinese medicine practitioner. I'm an acupuncturist and a coach, and I've been in practice helping couples trying to conceive since 2010. So as I said, today we're talking about 4 things to know about your cycle if you're trying to conceive naturally. Now, why is this important? Because if you don't know these things, it may well be hard for you to tell when you're ovulating. And if you can identify your fertile window, i.e. when you're ovulating, you're more likely to fall pregnant. Now, I don't know about you, but I certainly didn't get taught this at school. Wish I had. There were so many years that I spent trying not to fall pregnant. And if only I'd known that I couldn't fall pregnant at certain times of my cycle, like straight after my period or right before my period, it would have meant I would have experienced far less worry and anxiety. Now, you may already know this, so excuse me if I'm telling you what you already know. But what we do find is that a lot of women who are just starting out on their fertility journey don't know exactly when they're ovulating, and they're not quite sure how to identify it. So that's what we're going to talk about today. All right, so let's start. Number 1 in 4 things to know about your cycle if you're trying to conceive naturally is if you watch the mucus changes around ovulation, you should notice a change that will indicate your most fertile days. Now, what happens is when we're nearing ovulation is that our mucus changes from pasty or crumbly or non-existent for some people to more like an egg white. Now, this is quite graphic, but it's really, really important if you're looking for fertile mucus that you understand what it is. It's actually, in medical terms, called spin barcade. And this is because there are strands in that mucus that run long ways so that sperm can swim up the mucus. Now, for you to identify, whether you've got that mucus or not, you'll either see it on your panties or your liner, or you'll see it when you wipe, on the paper. And if there's enough, you'll be able to see that it's like egg white. Now, not every woman has significant mucus changes around ovulation. It doesn't mean that you won't fall pregnant if you can't see the mucus, but most women will notice a change if they pay close attention. All right, so that's our first of 4 things. Number 2, BBT tracking is a really useful tool in assessing ovulation and tracking our cycle. Now, most women are able to tell when they're ovulating by another sign, right? Not just the mucus, but by another sign, which is a raise in their basal body temperature or BBT. Now, this is if they have a regular cycle. If we have an irregular cycle, it can be harder to tell what's going on, but you can still try and track it and you may well see a pattern. So why do we take our BBT? We take our BBT because we want to be able to see when we've ovulated. Generally, our temperature will rise once we've ovulated. So the way to take our BBT is using a vaginal or a mouth thermometer. Now, a vaginal thermometer is it's generally more accurate, but you can still use a mouth thermometer if you're more comfortable doing so. You can ask your pharmacist. Now, we have to track our temperature every day, our basal body temperature, and we take it at the same time before we get up out of bed. All right, and we mustn't have gotten up for 3 to 4 hours prior. So we mustn't have stood up for 3 to 4 hours prior. Why? Because that actually will raise our body temperature and give us a false reading. Now, generally we need to do the same time every day, as I said. If you wake up earlier on the weekdays than you do on the weekends, unfortunately you're going to need to set your alarm on the weekends if you wake up later. So you might, pick 7 o'clock if that's what time you wake up during the week, set the alarm and go back to sleep, so that you're taking your temperature at the same time. Now, what we're looking for is not the absolute temperatures themselves, but we're looking for a 0.2 to 0.3 degree rise between the follicular phase, in other words, before ovulation, and the luteal phase, which is after ovulation. Now, some women find it hard and find it a little bit stressful if their readings aren't showing a clear pattern. But if you get stuck, you can ask your Chinese medicine practitioner to help you. You can ask your GP to help you. They should be able to help you. Or you can certainly look online and you'll find a lot of information to show you what those patterns should be. What these temperatures generally help us from a Chinese medicine perspective, they help us to see if there's an imbalance in the yin and the yang, imbalance in the follicular and the luteal phase, and help us to see if there's anything that needs addressing. All right, so that's number 2. Number 3 of 4 things to know about your cycle if you're trying to conceive naturally is, if it's harder to tell when you're ovulating, use ovulation predictor kits every 1 to 2 days from around cycle day 10. Now, what the OPKs, I'll call them, ovulation predictor kits, what they look for and what they pick up is something called LH, or luteinizing hormone. And they also, some of them also detect E2, which is our estrogen rise, right? And generally it's a urine test. And what these help you to see is they let you know when you're coming up to ovulation and when your peak day is, all right? Now, if you have PCOS or PCO, polycystic ovaries, it can be hard to discern exactly when your ovulation is, because sometimes women with PCOS can have extended LH surges. But generally, if you're on a fairly regular cycle and you don't have PCOS, the ovulation predictor kits are generally, accurate for most people. However, there's about 1 in 10 women who really struggle to get a positive result on the OPKs. We don't know why, but you may have a typically high or low luteinizing hormone. You may not have a typical LH surge, or you might have 2. So not all ovulation tests will catch ovulation. And if this is the case and you find, that it's really difficult for you to pick up your ovulation on an OPK, a semi-quantitative test rather than a threshold-based test can work better. So just ask your pharmacist. It'll all depend on your hormones. The interesting thing is, us humans are not an exact science, unfortunately. So it's not always going to be perfect, but most people are able to pick up the OPKs, see those couple of days before ovulation, and then pick up their peak day. Now, if you've been trying to conceive naturally for around 6 months or so with no results, it's definitely worthwhile getting your reproductive hormones checked with your GP. Now, ideally, you'll get them checked. They'll do a blood test on cycle day 2 to check the follicular phase hormones, and then also on around 4 days post-ovulation, whenever your ovulation is. So that might be, your cycle day 18, and that's to check that you have indeed ovulated. So they look at progesterone in that second part of your cycle. All right, so that's number 3. Number 4 of 4 things to know about your cycle if you're trying to conceive naturally. If you experience severe pain or unusually heavy bleeding during your period, then it really might be worthwhile seeing a fertility specialist to run some tests. Now, they may choose to run some scans or do a laparoscopy to investigate and see if there's anything else going on. So I'm just switching off my phone. Like endometriosis, for example, right? But a disclaimer here is that not everyone with heavy and painful periods has endometriosis, and not everyone with endo has pain and painful periods or heavy bleeding. But for us in Chinese medicine, heavy periods, dark blood, clotting, and severe pain, or even moderate to severe pain, means to us that the blood is not flowing as smoothly in the uterus as it should. And we're going to use certain acupuncture points, protocols, and perhaps even blood-moving Chinese herbs to help reduce the pain and to smooth the flow of blood. And what we like to see happen over time is an improvement in blood flow, so more fresh red blood and less clotting. We'd like to see a more medium flow and less pain. And these are all signs that the blood flow in the uterus is less obstructed. And for us, that means that the uterus is more conducive to an embryo being able to implant. All right. Now, just a little side note here. Every one of us is different, and we don't always fit the clinical picture that I've just described in these 4 things. So if your BBT, or your basal body temperature, or your mucus, or your OPKs are not what I described, it doesn't mean you can't fall pregnant. These tools can just be very helpful in assessing when you're ovulating so that you can know your peak day and you can really find out when your fertile window is. So to recap, number 1 of the 4 things to know about your cycle if you're trying to conceive naturally, number 1, If you watch the mucus changes around ovulation, you should notice a change that will indicate your most fertile days. Number 2, basal body temperature or BBT tracking is a useful tool in assessing ovulation and tracking our cycle. If you get stuck with that, let us know. Number 3, if it's harder for you to tell when you're ovulating, use ovulation predictor kits every 1 to 2 days from around cycle day 10. And number 4, if you experience moderate to severe pain or heavy bleeding during your period, then it might be worthwhile seeing a fertility specialist to run some tests. I hope that has been helpful for you. I hope it was insightful if you are trying to conceive naturally. Any questions, any comments, any input, please just let us know in the comments box below. For more detailed and resourceful info, visit our Facebook group or our Instagram, or sign up to our mailing list at acupuncturepregnancy.com.au. That's it for now, and I will see you soon. Bye for now.